Okay, now, so what? I have a couple of things to work on. We're going to see if I can get this. I'm doing it once more. Then I'm not doing it again. Ever again. Oh, why didn't you tell me to do it fast? She just didn't do it fast. Okay, here. I finally got it to work because I didn't let go. It's on me. Okay. Do not do not be we'll have to wait till it comes up. So this is a picture of mother and daughter. The interesting thing is, guess which one? There you are. Facebook JPEG. That's a bit. That is my daughter and granddaughter. Daughter, granddaughter. What? What is that now? I did. I already did this in one of my classes, so I'll give it to you. She will be 22 December 3rd. She will be 38 February 26th. As I'm fond of saying, you do the math. That my daughter had her when she before she was 16. That's the point of the math. So don't. So for parenting questions on childhood behavior, I am not the best source. What? Her. That's her daughter. This is her and her daughter. 15 and a half. 15 plus. And I'm sure she wasn't the first girl that happened to, and I'm confident since then there have been others. Just say. So that's the object lesson there. But so I have to find out what she wants. Now that they're both over 21, it's scary. Because we went out, because my son actually will be deploying Friday. But we went out, we had lunch, and all of a sudden oh, I want to get a drink, like a drink, and she's pulling out her ID, and I'm like, that's the first time that happened.
Wait, she your oldest grandkid?
Yeah, yes. My other two are like official grandkids, like 6 and 5, and we had a new one on Friday who's new. Friday, she was born Friday. My wife, she is my step granddaughter. That was my wife's first granddaughter. We want to make a distinction, which we do. Opal, Opal. So I'll have more pictures in the future. Now, so much for that. Now, so much. I figured you'd show it to you. That's what I have. So you can imagine what I've had to deal with over the years. So we digress. Okay, first thing. So I want to tell you a little bit about the spinal cord, which is not going to be on. We have a question or two on the final, on the written part of the final, but no pictures of it. And spinal nerves, which would not be on it, but it's for this, for the dissection. I'll do it briefly because I'm not doing it again if I do an AP. So, because I think it's important. No, listening. Subject to change without notice. That's subject to change without notice. That's, you know, those are the kinds of things that we'll probably be deciding over the next departmentally. Because many of us are at the point where we would have to get the dean to sign off. We're already doing overload. So you're only allowed to do 2 overload courses. After that, the dean has to sign off. So I'm doing a full overload class commercial. So I don't know if they're going to want us to do it. We are going to do it. This is it. I'm going to do a take home session. You don't have to physically be here. Fine. Anyway.
Oh my god, thank you. It's online. Wow.
No, I'm going to send it to you.
Can we just email it back to
You're
you?
the answer to you.
Just now?
Okay, so here's how. I think there's about 25 questions, answer sheet style, and so I'll basically, it'll probably be easier I'll send you something that will function as a scan truck.
Okay.
It's like an online scan truck that some of us use.
Like the first test.
Yeah, but this is one that you can take an image and send it back to me. So I can just put the image on my computer and put my phone up to it and try to create the answers.
Works for me.
And for me. And then the other one will be labeling stuff, and I'll probably have maybe another 20, I'll have like a labeling answer sheet you did on the midterm, you remember that? I'll make a copy of that, and that you can just send me the 2 pages.
Okay.
You can just basically send me the answer. Now, they only be 1 page, I have to see how many. We're good, I will get that, I was gonna do that today, but because my computer died, and I hate next week, but they finally gave it back to me Monday, and I can't even connect with the University of Richmond. So it still needs work, so I may have to print it at home, and then bring it here and scan it and forward it to all of you. So I'll send it undoubtedly in an email to everybody. So I would like, it would be best to get that back. Surely, I prefer it by Wednesday. If it has to go later, just let me know. Friday, we do have a little bit of a window. It's fine. As soon as you get it done, you can focus on it. That's the announcements part of the program. You don't have to be here for me.
So we don't.
Sorry. You can be.
We come next week, yes or
No, I only
no?
have a
Today's the
job
last day here.
What?
Today's the last day.
Yes, this is.
We don't know. Are you gonna miss us for us to drop it off?
No, if you want to, I'm not gonna be. Drop it off in my office or my mailbox or in the other building.
Oh, that's
What?
I don't care. It's easier it is for you. Okay, moving on. We're being recorded, please. No camera. So, point number 2, I want to go over that. Point number 3, one of the students couldn't be here. I'm trying to remember who he is. Tall guy, Alex. Yeah, he had to go to a funeral, so that's a reason why I would be helpful when we do the dissection if you could take some pictures and I can send him the pictures and he can look at the pictures and then he can write his report, because that's the kind of, it's not like I just didn't show up that day. That you got that kind of thing. So that's important. Okay, I'm making this as brief as possible. Oh, please. Answer to your question, Thanksgiving was fine because we never know how many we're going to have left with my wife's mom, who's 97, but unfortunately my wife's been kind of stuck there Saturday, Sunday, Monday, Tuesday, Wednesday. I'm hoping she gets home. It's not a lot of fun when you're basically stuck with your 97-year-old mom who can't do a whole lot. So she's like doing full-time care. But we went out to, and I don't recommend this for Thanksgiving dinner. I've never seen that many people. We were here at, are you ready? Golden Corral.
I think on TikTok it was wrapped around.
The line that was, were you there?
No, I wasn't there, but I see the video.
The line was wrapped around. I have never seen that many people at that place. I don't recommend the food, but that's her. She has a relationship with, she knows all the servers. She goes there every Sunday. And it's like everybody comes and says hi to her. It's just something she really looks for. At 97, there's not a whole lot to look forward to. So that was we do that, and we'll probably be there on Easter, and we'll probably be there on Christmas. Oh, help my stomach. It's okay. It's all right. Hey, the object lesson is people who take good care of their parents. It's an important thing. Okay, I don't mean to offend anybody. To me, there's a special place in heaven for people who take good care of their parents. My sister and my brother-in-law were wonderful with my mom. She got older because they lived close and they absolutely took great care of her. And she was in a nursing home. My wife's mom lives by herself, which is very difficult. It's a long story. Nevertheless, and the good thing about today with her not being there, the happiest member of my family is the dog because he's back at Camp Bow Wow. He's with his friends. He is running with his buddies. He is a happy dog. Nothing more important.
I was thinking about taking my doctor. Is it a good place?
What?
Is it a good place?
Hey, the one by us is great in Cranberry Township. Love it. Okay, moving on. So much for the animals related stories, so I can get you out of here in a reasonable time frame. Briefly, you may have done this in lecture. I'm not going to have, it's hard to, I do have a couple of labeling things on that. The difference between the spinal cord, and another aside, now that I have the computer, I can generate that YouTube. I tried to send you, I don't know if you got it, the recording from last time from the 15th, or if you had a chance, but I will let you know that it is coming so you can at least look at it. Because it helps when, even if you're studying for lecture. So the spinal cord is different, starts at the foramen magnum. The fact that it ends at L1 and L2 is what allows us to do lumbar punctures or spinal taps. Also, the meninges, which are on a couple of those specimens on the brain, are different because the meninges surround the cord. It's not one layer. It's all, beg your pardon, it is one layer with fat around it. And that's what allows, particularly during birth, for us to do something called an epidural analgesic. It's not an anesthetic. Anesthetic is the absence of state of sensation. Analgesia means you're reducing it. You're quote unquote numbing the area. And so it's a lot of it has to do with the technique of the procedure. There's not a lot to it anatomically, and that's why I don't want to dwell on it. There's a couple of important areas. So, and the illustrations in here are not great. You have an enlargement here because everything going in and out of the upper extremity called the cervical enlargement. You have an enlargement here in the lumbar or lumbar sacral area to be more accurate, because that's everything going to the lower extremity. So the cord ends about here, well above the sacrum. And that means that it's tethered to the sacrum by a piece of meningeal matter surrounded by connective tissue called the terminal filament. And so we often refer to it in Latin as the filum terminale. So that holds, it's almost like laced through through the sacrum. What's interesting is that the nerves continue. The nerves go out through their appropriate intervertebral foramina. So even nerves that are forming up here are traveling all the way down to holes sort of front and back in the sacrum. So they are, and when anatomists would take one of these out and spread it out, and they sort of spread out all these nerves, they look like a horse's tail. So they called it the cauda equina, which means horse's tail. And then lastly, it ends in sort of a conical shaped structure. So it doesn't quite come to a point, but kind of at L1 or L2. And that's called the conus medullaris, which means medullary cone. The illustrations are not great. Again, the distinction here is there's fatty tissue with blood vessels and nerves that you can inject that and it will numb the area. And that's where people who are skilled doing that, and a lot of women prefer to have epidurals. My wife certainly did for all of her kids. And, that network of veins and that space between the bone and the spinal covering itself. In the brain, it's much, much thicker and distinctive, okay? Cerebrospinal fluid is in the arachnoid layer. We mentioned that a little bit before, between the arachnoid and the pia, what they call the subarachnoid space. And that's the whole idea. That's when you do a lumbar puncture, you go in between these pretty broad spaces between, so a fancy name is the lumbar puncture, or what's called lumbar centesis. When you centese something, you put a needle into it. Whether or not you put fluid in or take fluid out depends on the procedure. And so, but colloquially, we call it spinal tap. So you try, and it takes some skill to get through this and get into that space without hitting the nerve. Why you can do it there. If you did it higher, the spinal cord is pretty large and you damage it. So that, and the nerves kind of have a lot more give. So they're less likely, and it's not something a lay person would try. This is typically in the realm of an anesthesiologist. So there's the conus, the filum. It's held pretty tightly. They look like little teeth. So they call it denticulate ligaments. You'll see the picture. And then the nerves come out. And that's really all it is to it. So this is kind of what it looks like. You have, and the nerve, even though it's one nerve coming out, they come out and it's not like one nerve and a space. There's a lot of overlap. They're called rootlets. So there's multiple roots that kind of come together as a nerve that you will see there. That's interesting. Here is, let's see if they have it farther down. So here's the medullary cone. Here's that filum terminale. Here's that caudae coin. The nerves are rather substantial. So when they spread it out, it looks like a horse's tail. Again, that's about the highlight film for you guys. This is what it looks like. It typically has a butterfly shape, depending, this is up at cervical. And the gray matter are referred to as horns, the white matter as columns. So this would be dorsal columns, lateral columns, ventral columns. Use dorsal and ventral rather than anterior and posterior. And you have the same thing, dorsal horns and ventral horns. When you get into the area in the thoracic area, and some of the lumbar, they point, there's a little point, there's another horn. It's called a lateral or transverse horn. That has a lot to do with something you probably covered or covering now. You're looking at the autonomic nervous system. Those are where the sympathetic nerves. You're studying that now, I take it. Fight or flight, all that. That's about right. Love that. Here's what they look like, kind of here. Those little points there. So they'll call them a lateral horn in this textbook, dorsal and ventral. The distinction is a little bit different. How you know back from front is typically the dorsal horn where the sensory information goes all the way to the edge, not so in the front where it doesn't quite go all the way to the edge. And here you can see the layers, the pia mater, the arachnoid, and the dura. Not as distinctive as we see them with the brain, however. Sheep brain will give you a little information. 2 of those specimens have dura, 3 of them do not, that are there. Not a whole lot to say. That little strip of gray in the middle is called the gray commissure. The spinal fluid is in that. That's called the central canal. So the letter H or butterfly, whatever works for you, works. And here are the little rootlets. So they come together and form one nerve that has a sensory component, inflowing information, and an outflowing information, the ventral part of it. And then once it comes together, you get branches that go back and front that are mixed, meaning they have both sensory and motor information. So that bulge is where you studied nerve cells, okay? And nerve cells called unipolar cells, the cell body is kind of offset. These are where all those cell bodies. It's a really important area anatomically, the dorsal nerve root. Anybody who has herpes infection, shingles, where herpes viruses hang out, where they go latent, is right in here. So it can be all the way in the cranial area, anywhere in the spinal area, anywhere in the sacrum, anywhere along the spine, cervical, thoracic, lumbar, and all over. And the presentation that it has in adults after you've been exposed has a very famous name. It's called shingles. We learn about that in micro. Don't worry about shingles because a third of you are going to get it anyway. Just tell it, statistically. So it's not, I mean, you could try to prevent it with an immunization, but a third of you get it anyway. So something to look forward to as you get older. And it can occur anytime. And so we'll get into chapter and verse about that in micro. So we're not doing a whole lot of this stuff, and there's a lot of different tracks that are there that you can look at. With my advanced classes, we study ascending and descending tracks. They're really important because it's really how you, from the blue is sensory information coming up. The red is motor information going down. And again, it's a little bit different when you get funny sensations, like your arm fell asleep or your foot fell asleep. Those are like paresthesias. So normally there's been some pressure. Maybe it's, you slept the wrong way, the lack of blood flow, and we'll all feel that. Paralysis is different when there's actually damage. And it depends on where the paralysis is, whether the muscles kind of get limp, that's called flaccidity, or typically after a stroke, they're spastic. So, and we cover that a little bit more too. So depending on how much you got that in lecture, I don't know, but that's part of it. And depending on where the nerve is damaged, the spinal cord rather, you can either have paraplegia, that means lower extremities only are involved, or quadriplegia if it's up higher. So that's just something else. These are a couple of diseases. In micro, we cover polio, a little bit about ALS, which involves both what are called it's a motor nerve disease. Upper and motor was named for a very famous baseball player who contracted it and died rather suddenly after being, one of the greatest ball players of all time, named Lou Gehrig. And he died shortly after giving a very famous speech on July 4th at Yankee Stadium. And now they're involved. There's different ways that they're starting to work with it. So for all you if you're not a fan of baseball, you don't appreciate it. We always used to joke the Pirates are 2 players away from the World Series, Ruth and Gehrig. Babe Ruth and Lou Gehrig, who aren't coming around. They were teammates on the Yankees. I'm a Yankee fan. I grew up in New York City. We were Yankee fans. It was before there were Mets. Jeez. That's all for that. Goodbye for that. Now, one more. I do this because we do it again in AP. I do it again, and whoever's teaching you AP too does it again. But it's fun for me to do, so I like to do it. So we'll do the abbreviated Stein version rather than the long Stein version. Because nerves are, if you remember what muscles look like, nerves kind of look like muscles. They kind of come like that. There's like a bundle, and they've got fascicles, epineurin and endoneurin. Remember all those epimecium, perimecium? See? Happy dance. Okay. And when you say a mixed nerve, it's got motor and sensory components. So I'm not getting into all of that or how they regenerate, though it's very, very interesting. This is it. We have the cranial nerves. So I'll give you my intro. You don't have to memorize them. But down the road in AP2, you'll be having to learn more about them. When you take out one of these, you're going to see, it's like a label on it, the undersurface. You'll see something. There are 12. They're paired. They attach one all the way up into the cerebral lobes. That's the first cranial nerve. That's olfactory, smell. Then vision goes to the thalamus. So that's in the diencephalon, remember, and you should. That's called the optic nerve. And after that, it's very hard to tell what they are because they get smaller and smaller. And down the road, you'll probably have to memorize them. Don't do it. That's why I'm not having you do that now. I use either Roman numerals or I just use regular numbers. And we always used to come up with this called the mnemonic. We used to take the first letter, you try it. It's like that. Okay, you're going to get immunoglobulins. Immunoglobulins, there's immunoglobulin, NADG. So I remember the name. It's like prophase, metaphase, anaphase, and telophase. So heme. That's something you can remember. I'm a good one. I have one. I even have one for you in this unit that will serve you well in the future. No additional charge. Here's what they look like. Now the sheep, you'll be able to tell 1 and 2 because you'll see this is called the optic chiasm where the optic nerves crisscross. The pituitary most will probably end up being removed, and you will probably see a little bit of this, which is a very important nerve called the oculomotor nerve. After that, it's kind of sketchy because you're down at the medulla and the pons. This is the largest, by way of the thickest of all the cranial nerves. It's called the trigeminal nerve. It's 3 nerves wrapped in one. The ones, anybody who gets the one with dura, and it's labeled. So this will say sheep brain dura intact here, and these are sheep brain link. It doesn't matter. There's one you can take a look at. That's fine, you have to remove it anyway. Then you work your way down. And as you get farther down, they're just like little threads. It's all you can see on the sheep. On a human brain, you can tell them more easily. But by the time you get down, I have had cases where we've seen the sixth. After that, just like little threads. So it's very hard to tell if they're just a little thread of connective tissue or they're actually a nerve. Sorry. Hey, blame the sheep. Okay. Now, the nerves, and this is mostly correct, but not totally correct. The nerves, there's only two that are only sensory. Smell and vision, olfactory and optic, first and second. Years ago, we thought that the hearing nerve, the eighth, which used to be called auditory, now we know it does balance and hearing, we used to think it doesn't have motor function. It does. Motor function is like when you hear a loud sound, you can hear that fan. Over time, your nerves in your ear adapt to sound. It's like going to a concert. Eventually, you'll become less sensitive to it. It's almost protected. When we do anything with depression, you ever hear people call the Doors? Okay. I'm one of the few people left around who saw Jim Morrison in concert with the Doors, summer of '69. Here's the Beach World. They still have two of them. It's Rolling Stones still doing it before the death. So it's a long time ago. So all right, every time that granddaughter tells me I'm going to your, I have no idea who she is. But you know, every time she goes, did you pay for a set of tickets? I really want to see you. When I find out who it is, I have no idea. It's okay, I'm fine. We're all in that stage one. So all the others are mixed. They have some degree of motor or some degree of sensory, whatever. The oddball thing is 4 of them have what's called PS. You're studying that now. Parasympathetic function. It means they impact your gland. Most of them are fairly straightforward. Oculomotor, when you dissect the eye, you'll get more information about it. That's the one that has the pupillary light reflex. So that when you, like that, you know, and most people will have that when you do a physical exam, and you'll learn about this when you do a physical assessment. When you bring the light over, what happens, the pupils will constrict. When you move it away, they'll dilate. That's the pupillary light reflex. The same thing when you have an open object that comes closer, their pupils will constrict and they'll come closer together. That's called accommodation. That's mediated by a gland. It's called the ciliary gland, or ciliary zone, that attaches to, when you get to the eye anatomy, to the lens of your eye and adjusts it so you can see closer or far away. That's what the oculomotor does. That's really important. The other ones that do it are the 7th and the 9th. They're mostly salivary glands, or lacrimal for the facial nerve, hearing. And the one that has the longest of all the cranial nerves is the vagus. That's the one that impacts your heart, your lungs, your digestion, all throughout. So it's the only one that gets named vagus because they said it was like a vagabond, a wanderer. It wanders all through. It's the only one that leaves the head. But that's what parasympathetic is. I love this. It's like one of my favorite things to talk about. So I'll give you the lowdown on each one of those, just so you know what you're looking for, and then you'll dissect, and then we'll all wave. See, lost another one. It's okay. It's okay. Students walk out of me all the time. They insist. All right. So olfactory. So down the road, they might want you to know the anatomy, how they leave the skull, or how the nerve comes in or goes out. Sensory going in, motor going out. So olfactory, remember up here you had the ethmoid bone and it had the cribriform plate. It looked kind of like cruciform. And the bulb sits right on top of it, and little strands go through what are called the cribriform foramina. And they'll show you a picture. It's all sensory. How do we test it? We usually don't. Most people know if their sense of smell is there or not. But it's one of the reasons, in order to test for these nerves, you have to be awake. So when someone's not awake and you're not sure if you could hurt them, if you start, hey, smack them around like that, shaking them, because they may have nerve damage. What do we use? Smelling salts. Years ago, when I certified my office for UPMC's HMO, okay, and I was one of the first offices to do that, we had to have 2 things taped to the wall in every treatment room. Every room a patient would be in: a padded tongue blade in case they had a seizure, and a thing of smelling salts in case they fainted. Now, I don't know if that's required now. I don't see it when I go to the doctor, but years ago they did. So fracture, and it tells you if you can't smell, maybe you were struck in the head and it fractured that ethmoid bone. Okay, loss of smell. I mean, not a whole lot you can do. Vision, same thing. What do you do next when you're? And they used to do this if you watch football incessantly, like I do. This is my wife. Are you watching another game? How many is that today? 5? Yeah, only 4. How many of them involve the Steelers? Just 1. And then she starts yelling at me a lot. Excessive. Throwing things. It's okay. I'm used to it. But I want to see the game. And so what do you see when now they do it in the blue tent? This is how they test for concussion. So they'll start by giving you a number or a name or an address to remember. Now remember this, I'll ask you about it later. That's part of the concussion protocol. So after they know you're awake, what do they do? Hold up your fingers. How many have I got? Testing the optic nerve. That's the next test. That goes into the next lower area of the brain, the diencephalon. The smelling salts go directly into an area where it stimulates what's called your reticular activating system. And so what happens, their sensory, they go effectively, their extension or receptors are here. Rods and cones, about 90% of them cross over, about 10% don't. That's what allows you to see 3-dimensionally, what we call stereoscopic vision. And they crisscross right in that really important area. I asked you about the sella turcica, where the pituitary is. And on top of that is the optic nerve. And on top of that is where all the blood vessels going to your brain on the inside, called the circle of Willis. So it's a really important area. Okay? So you may see the remnants of the pituitary in and around that area as well. The oculomotor, there's 3 nerves that we look at together. There's even a formula to remember what they do. What we didn't talk about was this, is your eye. So the next test involves follow my finger. You've all seen it. Right? You know, I do the routine all the time. So here's the optic nerve. So here's the eye. So you have a muscle here. There's 6 muscles that move the eye up and down, side to side. 4 of them are straight. They're called rectus. So down here you have the inferior rectus. Here you have that makes your eye go to the side. It's called the lateral rectus. This would be, I'll just put MR for medial rectus. And up top, you pushing your eye up, superior rectus. These come in at an angle, can't draw it very well. This is called the superior oblique. It actually tends to rotate the eye kind of down this way. And the inferior oblique, kind of in the other direction. When it angles the eye, it angles upward. So there's 3 cranial nerves that innervate these. You'll never get the question wrong, never with this. LR6, SO4, 3. Bingo. Don't have to thank me, I do it for everyone. That means the lateral rectus is innervated by the 6th cranial nerve only. Superior oblique by the 4th cranial nerve only. And all the rest by the third, we'll have LR6, SO4. So that next term, we have to know that. We know it. They all go through, we look at the skull. There's a little gash in the orbit called the superior orbital fissure. There's one inferior, kind of one goes this way, one goes that way. One goes this way, doesn't have anything, it's over cartilage. One up here goes through nerves. They all exit or enter the skull that way. Why are they mixed? Because mostly what they do is move the eyeball up and down, side to side. Is if I said to you, where's your eyeball? Are you looking straight ahead, left or right? I'll bet you would know that, right? At least half. The other half, who wants to go away? Okay? I'm joking. We call that knowing where your body is in space. Proprioceptors. Very good. Give that girl a candy bar. What? Yeah. Proprioceptors. That's the whole, we know where we are, most of us. All muscles have those little sensors that tell you where they are. So that information gets encoded, mostly in stereo. So that's a hidden sensory element in a lot of nerves that we used to think were only encoded. The other big player that is in that third is that pupillary light apparatus. So if you remember, write down LR6, SO4, every medical school student in the world does it. That's what you should do. Why do you guys go, can you write on the test? My answer is, yeah, of course. Or you have a pen, or whatever you want. You write that down with the stuff that you memorize, you can write down right away. All the cranial nerves, all the formulas, all that stuff that isn't given to you. You've been holding it in, waiting for the test to start. You write it down. As we like to say, write the F down. That's why you asked that question. That's why I would ask the question. And, you can make little marks of it. That's test taking. That's a skill that is woefully lacking in students today. I'm not making a value judgment. We were really good test takers because we figured that stuff out. That saves you a lot of grief. That way you can, when you do stuff like that and look at test taking, questions, right? There's a class that you should take if you can find it online. It's called Educational Psychology. It's how teachers make up tests. Wrong answers, you know what they call a wrong answer? A distractor. It's designed to distract you. Give you something plausible. It could be that. No. Terrible. Here they are. Superior orbital fissure, where it goes, all the different things. You'll get into that next term. I'm skipping that for now. Come right back to it. Here's the so 3 is oculomotor, 4 is trochlear, it's the only one that comes from the back. 6 is the abducens. Now, and it doesn't take very long to go over this. This is the biggie. Understand, I'm not going to ask you about this stuff, but down the road, when you have a teacher or a professor who has an interest in something, if it's their area of research or something that's affected them, they're going to ask you a whole ton of questions about it. That's part of the game, and it is a game, is trying to figure out. See, when I would take a test, my idea was, I got you. See, I thought it was an intellectual challenge. I can figure out what you're going to ask me. And when you do that, it's great. It saves you a lot. Know your enemy. Sun Tzu. Okay, The Art of War. Think of it that way. So here, this would be me. I would ask a lot of questions about this because my wife has a disease that's horrible that involves this nerve. It's called trigeminal neuralgia. They'll tell you about it. Trigeminal means there's 3 nerves, and on the specimens that have like a bulge that's hard in the front, that's where the Gemini or the ganglia of those, it means 3 ganglia. So it's 3 nerves. So we call them, because we use the Roman numeral, V1, V2, and V3. The first one, that same superior orbital fissure with 3, 4, and 6, it's all sensation except for one component. Sensation here is called the ophthalmic branch. V2 goes through the foramen rotundum, kind of forward. That's the maxillary branch. You'll see the diagram. V3, the largest, through that very big foramen rotundum. That also includes innervation for the 4 major muscles of mastication: temporalis, masseter, medial, and lateral pterygoids. That's by far and away, and all 3 of them are rolled together. It's actually 3 nerves, actually 4, was the motor branch, and this is where it is: V1, V2, and V3. Here are the muscles of mastication: temporalis, masseter, the pterygoids. Here's this giant ganglia, kind of go back from your nose right about here, right against the brainstem. And what happens in certain people, we think it could be an enlarged blood vessel. There's no wiggle room. It presses on it. And this is what they call and what I like about the book, and why it's important to me. So listen, the homeost is trigeminal neuralgia, known as tic douloureux, the painful tick. It's like somebody, when it's firing, and my wife, she'll like that, in such pain. A gust of wind one day, if you know where Costco is in Cranberry, it's up on a little rise. We got out of the car. We were probably at the far end of the parking lot. I started to walk. She's next to me. I turned around. A second later, she's on the ground. A gust of wind put her on the ground. That kind of thing. She has to take a medicine called Tegretol 3 times a day, every day. It's the only thing that helps. There are days when she can't eat. There's days she's gone for a couple of days where just the pain was constant. It's horrible. You wouldn't wish it on anybody. Excruciating pain known, relentless, stabbing, occurring hundreds of times. And they ain't lying about this. They've tried, a lot of things have been tried. Surgeries have been very inconsistent. And my wife will be 66 in January. She's not having any surgery. Trust me. So that's why I mentioned that to you. It's a really interesting and important nerve. Almost done. The opposite, if that trigeminal is motor, basically, I beg your pardon, is sensory mostly, other than muscles of mastication. The facial is the opposite. It's all motor. Everything that allows you to wink, blink, smile, purse your lips, all of that type of stuff. You know, kind of lift your eyebrow, acknowledge something, kind of, you know, somebody's talking, you kind of go that way. You know, all those little movements that we're so used to doing, how we communicate, facial nerve. It goes through the stylomastoid foramen, between the styloid process and the mastoid bone that's back here. So right there, it's right, very closely associated with temporomandibular joint. So, and it does do some glands, lacrimal, tears, salivary glands. Taste, your tongue is kind of divided into a front and a back. The front part of your tongue, the anterior 2/3, facial nerve for sensation. The back of your tongue is more closely aligned with your throat. It's called glossopharyngeal. Glosso means tongue, pharyngeal means throat. This has and you will all see this in somebody you know, or if you're a nurse, you'll guarantee see this multiple times. We don't know what causes it. It's called Bell's palsy. So Bell's palsy is a facial droop. Most of the time, it goes away by itself. One half, and they'll have a mentor of mine, it didn't go away. He had it for a lifetime. A brother-in-law of mine had it for 2 months. It can be a tumor, arthritis, injury, infections after a virus, but sometimes there's no explanation. The brother-in-law of mine, he didn't remember where he got it. He was a 9/11 operator. He no longer works there. He's still alive. For my former brother-in-law, for 9/11 here in the city of Pittsburgh. Not an easy job. And unfortunately, they used to, after they were so stressed out of work, they used to go after work and drink. And that may have been a contributing factor. So, a real nice guy, good guy. Worked hard. That's the Bell palsy. So I've seen this, tears dripping or being conversely dry. As you can see, the recovery, a substantial majority for everybody. And there's a lot of anatomy from where it comes out, back here, and then if you can see the branch, 5 major branches all over. The only nerve that doesn't leave the skull. We used to call it auditory. Now, because we know it's two nerves wrapped and run, like the sciatic nerve is two nerves wrapped in one, called the vestibulocochlear, balance and hearing. The balance part goes to something called inside, it enters the internal acoustic meatus and sits in the temporal bone. You'll get a lot of that in AP2. It either goes to semicircular canals, which kind of tell you where your head position is, so you don't get car sick like I do. That's why I drive. I get car sick. I'm sorry. I'm one of those. I can't read in a car. And hearing, self-explanatory, it goes to something called the cochlea. This is the semicircular canals. This is the cochlea. You'll get to all that anatomy. Glossopharyngeal, 9, 10, and 11 all go through the jugular foramen. You might remember that from anatomy. They kind of go down. So this one, salivary for the parotid gland, that's the biggest of the salivary glands. Taste from the back of your tongue allows you to swallow. And so glossopharyngeal means tongue and throat. And so normally it's difficulty with swallowing and taste in that area. The vagus, again, the wanderer, all the way down, regulates your heart, your lungs, your digestion, all sorts of important, you'll learn all about these in AP2, how we control blood pressure, breathing, etc. Most of them are mediated through the vagus. So it's a really important nerve. So it goes through the jugular foramen and it goes all the way. It's a very famous illustration. And so what's interesting is it innervates your speech. And so imagine somebody with a concussion. She's got a list for her birthday and holiday gifts. Do you want me to send it? Yes. She knows I'm a soft touch. Well, what do you do for your grandkids? Huh? Yeah. You don't have, I know. I'm joking. So, hey, you could marry somebody who's 90, and all of a sudden magically have grandkids. Don't joke about it. I worried about my daughter for years with that. She dated a few guys who were my age.
Really? How did that make you feel?
I had a lot in common with the guys. The blonde one you just saw before. What? Yeah. Sugar. Yeah, she's got a website. No, she's got like a website that you go to. Don't even listen. Don't even listen. And don't be looking at my granddaughter. I've seen that. And so I've had that. My eldest came in when I was teaching at Chatham. This is like 15, 16 years ago. He's 24. He was getting his MBA. He was already an officer in the Navy. And the girl, he's walking in, the girls are all going like that. It's like, are you kidding me? Is your son dating anybody? Yes. Half the pharmacy department, half the pharmacy students at Duquesne. Not simultaneous. What? But, my son dated most of them in his day. I've had to put up with a lot as a parent. This is the only nerve, the easiest one to test. Okay? This is the only nerve that has a component from the spinal cord, used to call it the spinal accessory. It innervates two big-time muscles. Your sternocleidomastoid that lets you move your head up and down, side to side, and your trapezius that shrugs your shoulders. Muscles are strong. If you put your hands on somebody's shoulder or on somebody's head and say, try to move it, they're going to move it. Muscles are strong. You can move muscles against resistance. There's a whole way of testing muscles if you get into a field like that. So that's also the jugular foramen. And the last one is the easiest of them all. Hypoglossal means under your tongue. The hypoglossal canal we saw as part of, or almost right associated with the foramen magnum. They kind of go that way. They're the ones that let you stick out your tongue. How do you test it? Stick out your tongue. When you do something like that, when you say stick out your tongue, inevitably people stick it straight out. If they bring it to the side, you kind of go, hey, no, I told you to stick it out straight. If they go, I am, watch out, that's a problem. She got concerts you might want to go to. Did I tell you? No one who I will recognize. Well, whoever. I'm sure we go to Drake. Even I would recognize that. It's okay. It's all right. My sister was trying to get me tickets for my daughter said, who are they seeing? Stevie Nicks, who was with Fleetwood Mac. You know, it sold out like crazy. She tried to get me tickets. You want to come to that? Maybe. All right, that's it. We're done with that. That's the lecture part of the program. There's a handout here about the brain. Here's what you do. We only have 5 of these. There'd be 3 or 4 people. This is called Carosafe. Carolina Labs. These will not harm you before you away in the regular garbage. I wash them. So when they get opened up, we rinse them off with cold water suffices. Back here are dissection trays. You will not need the big trays. These little trays will work. There are scalpels, everybody. There are scalpels here. There are probes which can help to push the stuff. There are gloves here, many as I have. Large, extra large, medium. I don't see small, fortunately. And I pull out these drawers because there are scissors and whatever you do, well, tweezers that technically when you're science, it's forceps or pickups. That's terms for you. You're going to go work in a hospital. No, I rather know what a tweezer is, but you call them forceps. So they are there. The trays are here. Rinse them off first. However you want to group yourselves, use them all, and then we'll open it up from there. All right, everybody, we can get started. If you get one of the ones that have the Dura, this one's a little messy. Let's let everybody take a look at it. Knock yourself out.